administer your baby's hepatitis B vaccine. Do you have any questions before we get started?
Yeah, I have a few. Does the hepatitis B vaccine cause hepatitis B?
No, actually it doesn't. Hepatitis B cannot be contracted from the vaccine because it doesn't contain a live virus. It's made from a synthetic yeast product in the lab.
Well, does it cause, I heard it causes multiple sclerosis.
That's actually a myth. There's no current evidence that indicates that multiple sclerosis is caused by the hepatitis B vaccines.
Well, one of my friends told me that, her baby died and that the vaccine caused, SIDS.
That's actually not true either. There's no evidence that supports this. A majority of the SIDS cases occur within the first year of birth, which many parents may link to the hepatitis B vaccine because the 3 shots are given in the first year of life.
Well, that makes me feel a lot better. You said there's more than 1 shot?
Yes, this is the first shot of 3.
How do I know where to go? When should I get the baby's next vaccine?
Well, I'll give the first one today, and then the second one would be given between 1 to 2 months, and the third one no earlier than 24 weeks. And to get these, you can either take your baby to the pediatrician, some health departments, hospital pharmacies, and some retail pharmacies offer them.
Okay, I guess my only other question is, does it, are there any side effects I should look for or anything?
Your baby may develop a rash, fever, erythema, which is redness, swelling, or pain at the injection site.
Okay, well, I think that's all my questions, okay? Is it okay if I hold my baby while you get the vaccine?
That's okay.
Okay.
In order to administer the hepatitis B vaccine, you need a needle that is 25 gauge and 5/8 inches in length. First, you need to clean off the vial. Make sure that you do not contaminate the infant with any bacteria that may be on the top. Cut the needle. Withdraw. And then the site you would inject in is the baby's vastus lateralis, which is right here. You inject it in the middle third of the infant. Clean off the site. The medication. And administer.
Are you ready for me to administer your baby's shot?
Yes, I am.
Alright, let me put my gloves on. And I'll need to see your baby's leg. Alright. I'll clean off the site. And inject the vaccine. There you go.
Thank you for the vaccine. Alright, so the hepatitis B vaccine is known as Recombavax HB, 5 milligrams per every 5 milliliter, or the Energix B, 10 milligrams per every 0.5 milliliters. And it should be given before discharge and then at 1 or 2 months, and the final dose will be no earlier than 24 weeks, approximately 6 months. An alternate dosing schedule of 0, 1, 2, and 12 months is prescribed for newborns whose mothers have hepatitis B, surface antigen positive, and the infant would also receive the hepatitis immunoglobulin and HBV vaccine, and that would be given within 12 hours of birth to them. Older children, adults, and adolescents can receive the hepatitis B vaccine at any time. The second injection is 1 to 2 months after the first dose, and the third injection would be 4 to 6 months after the first dose. People who would most benefit from receiving the vaccine include medical and dental professionals, students, patients receiving transfusions, immunodeficient patients, and cancer patients. For those who are exposed to the hepatitis B through needle stick, blood, mucus, or etc., the hepatitis B immunoglobulin can be given to provide passive immunity to the virus. And people who should not receive the hepatitis B vaccine include those who have a serious allergic reaction or are severely to moderately ill.
Hepatitis B is caused by the hepatitis B virus. It is spread through contact with the blood and body fluids of an infected person. You might get hepatitis B if you have sex with an infected person without using a condom, if you share needles with an infected person, if you get a tattoo or a body piercing when tools were not cleaned well, or if you share infected items like a razor or toothbrush with an infected person. Signs and symptoms of hepatitis B include fatigue, mild fever, headache, lack of appetite, nausea and vomiting, abdominal pain, muscle and joint pain, constipation or diarrhea, skin rash, and jaundice, which is yellow tinting of the eyes and skin. In most cases, hepatitis B goes away on its own. Relief of symptoms consists of mainly at-home treatments, such as resting, eating healthy foods, drinking plenty of water, and avoiding alcohol and drugs. After the initial exposure to hepatitis B, which is within 7 days of a needle stick and 2 weeks with fluid contact, a person can receive the hepatitis B immunoglobulin shot and the first 3 steps of a hepatitis B immunization shot, which will treat hepatitis and you shouldn't get signs or symptoms of it. If the person has chronic hepatitis B, then the treatment involves monitoring the condition of the liver and using antiviral medication to slow the replication of the virus. If the extent of damage to the liver is severe enough, then you might need a liver transplant.
In regards to cost, insurance coverage, and assistance for the vaccine, the cost for each part of the vaccine is about $41. So for the 3-shot vaccine series, it'll be anywhere between $75 and $165. This can vary depending on where you get it and who's in charge of getting it. Infants up to 18 months and sometimes older children can receive the vaccine free of charge from most public health clinics. Insurance companies will cover the cost of the vaccine for infants and children. The hepatitis B vaccine costs more for adults, and insurance coverage can vary depending on the adult's insurance company and the risk group that the adult is classified under. If parents seek assistance for covering the cost of the vaccine, there is the Vaccine for Children program, and that's where the parent can contact to help gain coverage.